Lung recruitment has become an important element of a lung protective ventilation strategy. After a successful recruitment maneuver, the atelectatic lung is re-expanded, and the level of end expiratory pressure needed to stabilize the recruited lung is determined. The result is the elimination of atelectasis, the avoidance of cyclic opening and closing of alveoli. This, in combination with the limitation of inspiratory pressures and volumes, provide full lung protection against the damage induced by mechanical ventilation. The clinical application of lung recruitment still remains a highly empirical process, mainly due to the lack of adequate bedside monitoring tools that are able to follow such a dynamic process. The Open Lung tool is an online monitoring option that looks at the changes in lung mechanics during the clinical application of a recruitment strategy. On an adjustable timescale, airway pressures, end inspiratory pressure and PEEP, tidal volumes, and dynamic compliance are displayed after each single breath. The aim of this tool is to provide the clinician with a guide that can lead him through the complex process of recruitment and PEEP titration. In a first clinical evaluation, in which the changes in compliance have been compared with the changes in oxygenation, results have shown that compliance is a useful clinical parameter that can determine the efficacy of recruitment and is able to detect lung collapse after recruitment at the bedside. On this CD, we will show the ability of the Open Lung tool to monitor the principles on which a recruitment strategy is based. An experimental model that simulates the early stages of acute lung injury in humans is used. This tutorial material will provide the clinician with useful information about the clinical application of this new monitoring option. Ideally, it will also aid in understanding recruitment and its role in a lung protective ventilation strategy. The Open Lung tool will be used to monitor a recruitment sequence in an experimental pig model. Acute lung injury is induced by surfactant depletion after lung lavage with normal saline, producing a moderately injured lung. Ventilation is provided by a Siemens Servo-I ventilator, with the Open Lung tool option in combination with a Siemens Infinity SC9000XL monitor. This provides full respiratory and hemodynamic monitoring, including invasive systemic arterial pressure and pulmonary arterial pressure. After describing the baseline ventilation settings, the physician will lead us through the 4 principal phases of a lung recruitment strategy. Recruitment, find closing pressure, reopen the lung, keep the lung open.
The baseline ventilation consists of a pressure-controlled mode with a plateau pressure of 35 centimeters of water, a pressure gradient of 20 centimeters of water adjusted to obtain a tidal volume of 10 mL per kilogram, in this case 350 milliliters, a PEEP level of 15 centimeters of water, an inspiratory to expiratory ratio of 1:1, and a respiratory rate of 20 breaths per minute. The starting compliance value is 17 milliliters per centimeter of water. In an unstable condition, the changes induced during recruitment can lead to undesired side effects. Therefore, before starting with the recruitment sequence, the hemodynamic status must be assessed. In this phase, the inspiratory pressure is stepwise increased to a level above the estimated critical opening pressure. During the whole sequence, hemodynamic tolerance is closely monitored. In a stable condition, plateau pressure is first stepwise increased to a level of 40 centimeters of water as a consequence of the increase of PEEP to 20 centimeters of water. The PEEP level of 20 centimeters of water will be maintained during the recruitment maneuver to assure the stability of the recruited alveoli in this ARDS lung. After assessing the hemodynamic response and confirm the tolerance to the increase in pressure, we proceed to recruit the lung. The pressure above PEEP is first increased 5 centimeters of water, resulting in a plateau pressure of 45 centimeters of water. In the next step, the empirically estimated opening pressure of this lung of 50 centimeters of water is reached. This pressure level is maintained for 2 minutes. The compliance decreases to values of 14 milliliters per centimeter of water during this phase due to overdistension caused by the applied recruitment pressures. Hemodynamics show the decrease in systemic arterial pressures of about 20% compared to the baseline values. There is only a small increase in pulmonary arterial pressure, although the ventilation-induced changes on the pressure tracing are evident. After completing a recruitment time of 2 minutes, the pressure gradient is reduced to obtain pre-recruitment tidal volumes by decreasing the plateau pressure and maintaining the PEEP level. The immediate effect is an increase in compliance, in this case returning initially to pre-recruitment values. The settings at the end of this phase, before starting the surge of closing pressures, are plateau pressure of 38 centimeters of water, a pressure gradient of 18 centimeters of water adapted to attain a tidal volume of 10 mL per kilogram, and a PEEP of 20 centimeters of water. The compliance is 16 milliliters per centimeter of water. In this important phase of the recruitment strategy, the level of PEEP that prevents end expiratory collapse of the recruited lung is determined. This is done by a decremental PEEP trial in which PEEP is stepwise reduced. The corresponding changes in dynamic compliance during this reduction are closely monitored. A constant pressure gradient of 18 centimeters of water is maintained in this case. In the sequence, PEEP is first reduced from 20 to 18 centimeters of water. This is followed by an increase in compliance, indicating the relief of overdistension. The stepwise decrease in PEEP in 2 centimeters of water steps is accompanied by a stepwise increase in compliance. A maximum compliance at PEEP of 12 centimeters of water is followed by a plateau that is maintained at 10, 8 centimeters of water PEEP, and finally, from 8 to 6 centimeters of water PEEP, a continuous decrease in compliance is observed, indicating progressive lung collapse. With the cursor, we can go back through the sequence to identify the PEEP value that resulted in maximum compliance. In our case, this point is detected at a PEEP of 12 centimeters of water, resulting in a dynamic compliance of 25 milliliters per centimeter of water. In other words, an increase of 45% compared to the pre-recruitment compliance value. This PEEP value is taken as the closing pressure. To assure stability, the final selected PEEP value will be 2 centimeters of water above the identified closing pressure, in our case 14 centimeters of water. After detecting lung collapse, a new recruitment maneuver using the described pattern and the opening pressures applied is necessary to recover the open condition. Again, a stepwise increase in pressure observing the response in hemodynamics is performed. PEEP is increased to the level used during the first recruitment in 2 steps. First, to 15 centimeters of water, and finally, PEEP is increased to 20 centimeters of water, followed by an increase of pressure above PEEP of 20 centimeters of water, resulting in a plateau pressure of 14 centimeters of water. The effect on hemodynamics is again closely monitored. After a few breaths, the recruitment pressure of 15 centimeters of water is applied and maintained for 2 minutes. During this period, compliance falls abruptly to levels similar to those of the first recruitment phase due to the effect of overdistension. We see a similar hemodynamic response as shown during the first recruitment phase. After 2 minutes, the plateau pressure is reduced to obtain a tidal volume of 10 mL per kilogram, and the PEEP level is set at 2 centimeters of water above the identified closing pressure, in our case, a value of 14 centimeters of water. Compliance increases to similar levels as during the first recruitment. The steady-state final settings are plateau pressure of 24 centimeters of water, inspiratory pressure gradient of 10 centimeters of water, tidal volume of 350 milliliters, PEEP of 14 centimeters of water, and a respiratory rate of 20 breaths per minute. The final compliance is 28 milliliters per centimeter of water. The cursor leads us through the complete sequence, identifying the important phases with their corresponding settings. Baseline ventilation, plateau pressure of 30 centimeters of water, PEEP of 10 centimeters of water, dynamic compliance of 19 milliliters per centimeter of water. Stepwise increase in pressure, slow decrease in compliance. Long recruitment with inspiratory pressures of 50 centimeters of water. Compliance decreased to 14 milliliters per centimeter of water. Gain in compliance after removing the recruitment pressures back to pre-recruitment values. Progressive increase in compliance during the decremental PEEP steps. 18 of PEEP, 19 of compliance, 16 of PEEP, 21 of compliance, 14 of PEEP, 23 of compliance, 12 of PEEP, 25 of compliance. Maximum value of compliance after recruitment, 25 milliliters per centimeter of water and a PEEP level of 12 centimeters of water. Plateau behavior of compliance along various PEEP steps, from 12 to 8 centimeters of water. Decrease in compliance indicating ongoing lung collapse at a PEEP level of 6 centimeters of water. New recruitment with the same inspiratory pressures. Reduction of pressures to steady-state ventilation with a PEEP level of 2 centimeters of water above the value resulting in maximal compliance. Final settings, plateau pressure of 24 centimeters of water, tidal volume of 10 mL per kilogram, PEEP level of 14 centimeters of water, and dynamic compliance of 28 milliliters per centimeter of water.
The use of online dynamic compliance has helped us to demonstrate the efficacy of the recruitment maneuver, and more importantly, to detect the PEEP level that prevents major ongoing collapse after recruitment. The recruitment sequence should be recorded for later comparison with new maneuvers used in the evolution of the patient. On one side, this facilitates the procedure, as the pattern can be easily reproduced. On the other side, it provides useful information about the evolution of the patient according to the different responses to recruitment over time. During baseline ventilation, the setting showed end inspiratory pressure of 35 centimeters of water, a pressure gradient of 20 centimeters of water at a tidal volume of 10 milliliters per kilogram, PEEP of 15 centimeters of water, and a compliance of 17 milliliters per centimeter of water. This was improved to an end inspiratory pressure of 24 centimeters of water, a pressure gradient of 10 centimeters of water that resulted in the same tidal volume of 10 milliliters per kilogram, a PEEP level of 14 centimeters of water, and a dynamic compliance of 28 milliliters per centimeter of water after the recruitment sequence. The improvement in compliance will help to diminish the mechanical stress of the lung. When added to the avoidance of end expiratory collapse, the two most important goals of a lung protective ventilation strategy are met.